Everyone, it's Patricia Warby, Alchemy Therapies, and my emotional audit here. And today I want to talk about something very important, which is EMDR and birth trauma. Now, EMDR stands for eye movement desensitization and reprocessing. It's a bit of a mouthful, that's why we tend to shorten it to EMDR. And it's widely used for trauma of all kinds, including single issue traumas like being in a war zone, having a really bad traffic accident, perhaps being arrested or shot, or those kinds of experiences that are one-off single issue traumas that are very difficult to rationalize and get over because they trigger fear responses which are hardwired in to our back brain. But look, we also know that EMDR can be really powerful for what's called small t trauma, or the little traumas, the cumulative lifetime experiences that people have, particularly in childhood. And one of the most important experiences that every child has is their birth, okay? And they won't have a conscious recollection of what happened, but their back brain, which is online at birth, the limbic system and the brainstem will be recording what's going on. And so it's been very interesting to me to see if I could use EMDR for some of the birth trauma that I see commonly in my practice. Now, experiences in birth can be very, very traumatizing. Just having to come through the birth canal can be really hard. But of course, if your mother is stressed for any reason, if it's an emergency situation, emergency cesareans are particularly bad for that. Being induced, maybe you're born early or late and you have to go into ICU and you're separated from your mother. She may have difficulties with breastfeeding or bonding with you. I did a course on that, actually, attachment, attunement, and finding the authentic self, which I'll leave in the description. We have all kinds of experiences during those very, very first few weeks and months that are imprinted into our back brains, that can be brought forward into conscious awareness whenever we're triggered, but we may not know what caused it. We'll just get the symptom. So things like difficulties with swallowing, facial tics, which can be triggered by current events. You know, we saw a lot of that during COVID, where Bell's palsy or one side of the face would drop. Nobody explained why that would happen, but it's implicit memory. Bedwetting or urinary tract infections, over salivation or under salivation, difficulties with tears or crying can be to do with this autonomic imprint of birth experience. So it's just a really, really interesting area that I wanted to talk about. And I wrote a lot about this in the book, The Scar That Won't Heal, which I'll leave in the description as usual. But because most medical doctors are not aware of these implicit memories, and what gets triggered in the adult life can be relating to childhood past experience, they just treat the symptoms, and they call them medically unexplained symptoms, because a lot of these little things that happen to people over the course of a lifetime don't have an organic cause. And so they can't be explained because they don't have the model to explain it. Okay, so anxiety is another really classic example of a body-based experience, because believe it or not, anxiety, although interpreted in the brain, is actually a body-based experience. Everything tightens up, your muscles tighten up, your gut clenches. That sends information to your back brain that you're under threat, and that's why you get anxiety. And so just trying to treat anxiety as a brain condition is why it doesn't really solve the problem, because the problem is implicit memory stored in the body. Now, all sorts of emotional experiences are stored like this, and we often call this complex PTSD because it's very distinct from the single issue traumas that I mentioned earlier. And we need to look at how we can resolve these back brain implicit symptoms. And I wanted to explore how I could do that with clients who maybe were suffering some of these symptoms and didn't know why. And I came across a client not so long ago who had this phobia or fear that his parents were going to die. And every time he saw them or thought about them, he would find himself going into a horrible panic attack. And I wanted to explore where that came from. And as I started to work with him, using EMDR, what we do is we ask you to focus on left to right movements, usually across a screen. It can be done in person. It can also be done with sound in the ears, but I work online by getting people to follow my fingers. And we allowed him to just feel the panic in his body and watch my fingers as we worked and see what came up. And what was extraordinary was his body started to make these very jerky movements, like sort of stretching and clenching. And he said to me, I feel like I'm being squeezed and I feel like I'm going to die. I can't breathe. And I said to him, I wonder, but this feels like a birth experience. Just notice that. And as we went through it, he actually was able to experience and play out what had happened to him so that his back brain now knew it was over. And the symptom of panic around his parents disappeared from that day. Now, this may sound strange, I know, to those of you who are perhaps not aware of how powerful somatic work can be. But I've worked with hundreds of people, and I can tell you that once you resolve it as over, everything in your autonomic nervous system can reset. The threat response is then no longer triggered, and autonomic function settles down. So eye movement desensitization reprocessing, EMDR, is a really powerful tool, not just for the big T traumas, but for the little t traumas as well, which most people have some experiences in their childhoods that have triggered these symptoms. Now, how does memory work? How does traumatic memory work in particular? Well, normal memory is usually explicit. It has a sort of narrative to it, and it's stored in your hippocampus and other brain areas. But life threat tends to disable that part of your brain and make memory stored in the fear center, which is your amygdala, which are two little almond-shaped areas in the middle of your brain, which are like the smoke signals for life threat or any threat really to your existence. Now, when that happens, because there's no time stamp to this memory, it feels like it's in the present. It feels like it's always now, which is a problem for your body, because whenever you get a current stress in your life, it will trigger the previous memory of life threat, and the two will combine together. So these are cumulative problems, and therefore symptoms tend to ramp up over your life. That really explains why symptoms don't just disappear with time, or sometimes they go deeper and deeper and get more and more serious. When I'm working with people, the way I follow it is I look for these responses in the body, and in particular, I look for eye jumps, because they show me that memory is being processed. There's something about the way the eyes work that allows memory to be processed. We see that in dream sleep or REM sleep. If you've ever watched a child or an animal asleep and they're dreaming, you'll see the eyes are moving around underneath the lids. So it uses a natural process. And that's what makes it so powerful, is that it consciously changes the impression in your memory center of what happened to you, so that you now know it's over. So I just find these tools and techniques so fascinating. I've got many, many different videos. I'm going to post all the relevant ones beneath, because I want you to know that everything can be resolved if you use the right tools. And you have to work systematically, of course. You can't just, it's not a magic panacea for everything. You have to have probably 3 to 9, maybe sometimes 12 sessions to get through everything. But once you do, it's irreversible, and you've made huge improvements to your life course. And the chap with birth trauma, as I've said, never had that problem again. And many other clients of mine are now experiencing what I call autonomic relief. You know, they're not getting these debilitating symptoms of panic or fear or strange body symptoms that start to resolve within 1 to 3 sessions, which is extraordinary when you've had that for many years or decades. Now, obviously, I'm developing my own protocol. I do things a little differently from the way Francine Shapiro developed it. But I'm finding that the more that you can allow people to go into their body feelings and sensations, the quicker the resolution is. Most people live in their heads in terms of thinking through a problem, and that's not where the issue lies. It's in their bodies. That's where trauma is stored. So if you are interested in getting help with any issues you believe could be related to traumatic memory, please get in touch. These lifetime issues, you don't need to suffer anymore. And I hope this was of interest to you. Please subscribe. Take care, everybody. Bye for now.